Welcome, everyone. Thank you for joining us for the final event in our summer series. Today, we will be hearing from Nathalie Simoneau, Director of Gender and Social Inclusion for World Wildlife Fund. Nathalie joined World Wildlife Fund over 10 years ago as part of the People and Conservation team, working on population health and environment initiatives. She has a background in public health, in nutrition and food security, and holds a master's degree from McGill University's Center for Indigenous Peoples, Nutrition and Environment. She has worked for nearly 20 years in program design and implementation, providing strategic and technical guidance and supporting policy and advocacy efforts through various international programs to influence the adoption of integrated approaches in conservation programming. Thank you, Nathalie, for being here today. Feel lucky to have you, and we're really looking forward to your talk. The floor is yours.
Thanks so much, Stephanie and Nathalie. It's my pleasure to be here and welcome everybody. I'm eager to discuss all of these issues of inclusion and gender in the world of conservation. So I will be talking today about the role of gender and social inclusion in integrated health and conservation initiatives that WWF is involved in and has been involved in over the past several years, I would say almost 2 decades now. So the presentation will consist of a quick overview of WWF social policies and our environmental and social safeguards framework, and how we apply that on the ground and in all the work that we do. And I will end with giving you an example of on the ground work that we do to really put in perspective and in action what these policies and safeguards actually require us to do. And the example will be from our PhD project and conservation program in Southeast Cameroon. So let's start by giving you a bit of an overview of what our social policies are and what our framework, safeguards framework, is about. So our social policies at WWF have been around for more than a decade, but especially for the Indigenous Peoples policy, it was first developed and adopted in 1996. And then was updated in 2008. And the rest of the policies were came on board anywhere between 2008 and 2011. And the last one to be adopted was the gender policy. Also, it is noteworthy to say that recently, this summer, actually, and in the spring of this year, we have undergone a whole revamp and a whole update of our social policies. And WWF has conducted across the WWF network a public consultation of our social policies and our environmental and social safeguards framework, to make sure that we are, just to be out there and share with all the experts in social development and in human rights and safeguards, and to put under the radar all our policies and safeguards, to have feedback from the outside world, and then these will be updated and finalized over the next couple months. So right now, what has been updated are the human rights policy, the gender policy, and the Indigenous Peoples policy. And our social policies apply into everything that we do, including policy and advocacy work, as well as at the institutional level that we strive to apply our policies across the board. As for the safeguards framework, the safeguards apply to the work that we do on the ground in landscapes and seascapes. And it's an approach of do no harm, which means that we identify and avoid and mitigate and minimize any adverse environmental and social impacts that may arise as we apply interventions and we implement projects in those seascapes and landscapes. But it's also a way to do good as we strive to make sure that safeguards will improve the chances of projects delivering better outcomes for people and, of course, for the environment. Both together, the social policies and the safeguards framework apply on the ground, and they work hand in hand. Next, just to give you a bit more of an idea what our safeguards are made of, it's a set of standards, and we have procedural standards and substantive standards. And I will not go into many details, but just to give you an idea what, and to also bring your attention to one of the procedural safeguards that I will go into a bit more today, which is the stakeholder engagement standard that we put a lot of emphasis on at WWF when we do our work on the ground. So these procedural standards apply always in any type of projects, any level of risk the projects may have. These standards apply. So you always have to conduct a stakeholder analysis and consultation and so on, and no matter what type of project you have. And the substantive standards are those that may be triggered according to the type of activities that you're implementing in the landscape or seascape and their level of risk, or the risk that may be surfaced from implementing these activities. For example, if you have if you work in an area where there are indigenous peoples, you will pretty much automatically trigger that standard and have to develop an indigenous peoples plan to make sure that you address the needs, aspirations, and the rights of indigenous peoples accordingly. So that's a quick overview, but now I'm going to dig a bit deeper into the stakeholder engagement and what that means. So what is stakeholder engagement? So it's the participatory components of stakeholder management throughout the life cycle of a project or activities or strategy that WWF implements on the ground. And what it involves is, first of all, is to have a rigorous stakeholder analysis, which means that you have to identify all the people, all the stakeholders that will be affected by your project or by your activities, identifying those that are assessing their interests and their positions. Are they powerful? Are they influential? Are they vulnerable? Assessing their rights as well as rights holders or duty bearers, depending on the type of stakeholders you have in the landscape. And that also helps in identifying the dynamics between stakeholders, meaning that you may have, groups of stakeholders that form alliances and work well together, but also on the flip side, you may have some stakeholders that are in conflict together, and that may affect the way the project is, the intervention are developed, and the way you address certain issues in the project to de-escalate any existing conflicts or to avoid the development of new conflicts. So that's a very important part and of the process of stakeholder engagement. And then that leads you into then identifying who you will consult with, and the process of stakeholder consultation is also very critical for the decision making around a project and around the way you will engage with your stakeholders over the life of a project. And so it's basically a two-way dialogue with WWF and all interested and affected parties throughout a program cycle. It's also a way to be transparent and inclusive, you know, as you conduct your consultations, by disclosing information, by reporting regularly to your stakeholders, and in a way that they also are, that is appropriate, and that they have mentioned how they want to be engaged in the project. So it's really a dialogue between WWF and the stakeholders to make sure that everybody's on the same page as to how they want to be engaged in the project and the level of commitment and so on. So it also includes the feedback about how they want to be involved, as I said. And it's another way also to make stakeholders aware that they have resources if they have a complaint to make about anything relating to the project, and they can file grievances, and you know, WWF takes those into very seriously and into consideration to address them. And so it also helps in really having a rigorous and very active adaptive management approach. So what does it look like on the ground? So how are social policies and safeguards applied in our work? So we have a human rights-based approach, of course, of social policies, and standards, safeguards framework, sorry, are applied to ensure our interventions respect human rights, are inclusive, equitable, gender responsive, they are empowering, and they respect the needs and aspirations of all stakeholders, and especially those that are the most vulnerable groups in the communities who may not have a voice and may not be involved normally in the decision-making processes and so on. So what does that mean in concretely? It means that we have to go through a process to make sure that we have all the necessary information to really develop the best possible plans to address all the issues that are raised in the project area, and with the type of activities that are going to be implemented. So that starts with a screening of all the activities through a tool that we call it a screening tool, basically, that helps us, according to the activities that will be implemented, it helps us surface any risks that will then lead us to develop any mitigation plans to reduce or avoid the risks, and also to integrate the plan and into the monitoring system so that we ensure that we know at all times the progress of the implementation of the plans that have been developed. As I just talked about, stakeholder analysis is very high on the priority list of things to do at the start of a project. Stakeholder consultation, and leading to also develop a stakeholder engagement plan that will be part of the project lifecycle and will be used to make sure that we engage with the stakeholders the way that we intended and the way that they expect to be engaged into the project. We often do a number of things, but something that helps us understand the context in which we work. In some places, we've been working there for decades, but it doesn't mean that we know everything in all the sectors, in all the different aspects of the population and the communities that we work with. For example, in some places, we've been working, like I said, for decades, but you know, the taboos and the gender dynamics may not be well known, or they may not be apparent to our staff and partners. So it's always a good idea to conduct a political, social political analysis or context analysis with, and often what is very important to recommend is to do a full-blown gender analysis, taking into consideration all the gender dynamics and the dimensions of the area. And that leads us to develop a mainstreaming strategy or an action plan as part of as a cross-cutting issue and a cross-cutting part of the conservation programming that we implement in the area. In Cameroon, the example that I will talk to you about in a few minutes, this is basically what has happened. We have been working in Cameroon for decades. However, when the PHE project started, it was clear that we needed to understand a bit more of the gender dynamics and other factors that affect the well-being of people. So these types of approaches and assessments need to be done at the very beginning, and that's what we did there too. So I'm not sure how well versed everybody is into the world of PHE, population health and environment, but just to give you a bit of a description of what it is and what it means to have PHE approaches or integrated approaches such as PHE into conservation programming. So PHE is well known to help meet socioeconomic challenges and the needs of communities through livelihood activities, while helping safeguard the biodiversity. WWF has worked for, like I said earlier, for nearly 20 years in implementing integrated approaches such as PHE. And because we work in high biodiversity areas and areas that are often very isolated and remote, and they're home to many, communities, local communities, ethnic minorities, and indigenous peoples. But these people are very highly dependent on their natural resources, and it's their subsistence, it's their survival, but they most often lack the basic health services, infrastructure, and to enjoy a healthy life because they are so remote, and often the government structures don't reach them because they're so isolated. and so they are faced on top of things with dealing with, mounting pressures from the outside world on illegal, on poaching, illegal logging and mining, and that really affects and threatens their natural resources, the ones that they depend so much on. So having an approach like a PhD helps to provide the basic health support that these communities need. And so while helping them to understand also the linkages between a healthy environment and their health, it improves their well-being, and it fosters also their involvement in and their interest in wanting to conserve their environment if their basic health needs are taken care of. So the PhD approach also creates synergistic links between human and ecosystem health. Integrated projects improve human well-being, as I said, and it encourages sustainable use of natural resources. It promotes sustained delivery of ecosystem services for the medium and the long term as well. So the types of integrated and health approaches that WWF has used in the past and we're still using currently involves, but it's always also according to the needs of the communities we work with, but it can involve anything, as written here, having a project with a WASH approach to it for supplies of drinking water, sanitation, hygiene, maternal and child health care, improvement in nutrition and food security, prevention of treatment of infectious diseases. Very important provision of reproductive health services and voluntary family planning in places where there are unmet needs, which are pretty much everywhere we work with, because of the fact that these communities are so remote and lack all services basically. And also we work on strengthening the health systems in the project areas that we work in, and improving the capacity of the staff, educating them on the linkages between health and the environment, and also improving the access to information, which is sometimes lacking. But also this type of approach, the PhD approach, is a great way to foster gender equality and to empower women. It builds their capacity, and so they can participate more fully and become change agents in their community. And by this approach of integrating messages and promoting best practices in health and sustainable development and in an environment as well. It gives women opportunities to engage more actively in community decision making, including on the management of natural resources, which women use and are often expert in, but they often have lack of opportunities to share their great knowledge. And so by gaining access to knowledge and services, they can make informed decisions about the care of their own health and that of their family as well. Just to give you an idea, the WWF has worked across the world in the PhD. Today I'll be talking about Cameroon, but we've also worked over the years in Nepal, in India, in Bhutan, Philippines, Mozambique, Kenya, and many countries of Central Africa. So here we are. I will share with you the experience of working in Southeast Cameroon with indigenous peoples and local communities on PHE, on the PHE approach that is working really well integrated with our conservation programming that we have there. So we're talking about the Lobaike National Park area in Southeast Cameroon. And so the park was created in 2001, and it's part of a what we call the Sangha Tri-National Protected Area Network. So on the map, you can see the three very green areas, and these are this is the network of the three parks. So you have Republic of Congo, Central African Republic, and Cameroon that are part of this tri-national protected area network. It's a very remote area. It takes 2 days to get to Lobaike by road from Yaoundé in Cameroon, and it's a very difficult road. So it's remote, but it's very rich in biodiversity. It is under a lot of pressure from poaching and logging. The buffer zone, so the area around the park itself includes 21 communities. Of those, there are 26% are Baka, indigenous peoples, 52% are Bantu, so the majority ethnic group there, and 22% are immigrants from other countries, sometimes, most often Republic of Congo and Central African Republic. The area, as you can imagine, is quite poor, and people lack access to basic health services, safe drinking water, and economic opportunities, because markets are so far away from where they are that it's difficult to entertain any value chains in that area. There are some forest concessions that are established in the area, and these provide some sort of infrastructure support and development, but mostly for roads. So it's not, and some health services for those who work for those concessions, for community members who work for those concessions, have access to better health services than the rest of the communities. And so here, basically, the conservation program in the Lobaike National Park has been going on for a couple decades, and PhD and WASH initiatives in that area has been present for now almost a decade. So, and it has been very helpful for the well-being of the communities we work with. So what type of interventions does the PhD initiatives bring to Lobaike? So it's as we've been talking about, it's an integrated approach that informs organizations seeking to improve the ecosystem health and conservation outcomes, along with improved human well-being living around the area. But a very important aspect of this approach and this project in Lobaike is that it recognizes and respects the local knowledge of both women and men, and of the marginalized groups, including the Baka indigenous peoples, who, as you know, depend very highly on the natural resources for their subsistence. So the approach is to ensure gender equality and social inclusion mainstreaming of in the program in Lobaike. We have taken a few steps to make sure that the mainstreaming of these elements is done properly. So by conducting at first assessments on the knowledge, attitude, and beliefs of the community members as it relates to PHE sectors, and to basically best target our interventions, but always with taking gender dimensions into account as we do that. I've also had to do more in-depth research to ensure that we understand more deeply the cultural beliefs and the taboos of the Baka people on family planning and reproductive health practices, as it was clear over the years that this group was not adopting the best practices that we were promoting, as opposed to other groups in the project area. So we had to dig a bit deeper to understand more what were the barriers for them to adopt these practices. And so that really enabled us to target our interventions and our behavior change and awareness raising approaches to the needs and to the beliefs of these of this group. And you know, in part, but a very important part, to try and address the high rates of teenage pregnancies and maternal and child mortality in this area. So we've engaged the stakeholders from the design phase of the project throughout the project life. Also, we engaged with them, and that led to also the commitment and the participation, high participation rates of the communities, and including the local authorities, the village chiefs, and the government partners that were a lot more inclined to work with us as we were really co-designing the approaches with them. And the fight against malnutrition and food security was interestingly led us to have engaged discussions with communities on finding solutions to curb the issues of poaching. So that was something that we had not anticipated, and was a very efficient way to address poaching issues, along with reducing the malnutrition and food insecurity issues in the area. So the main activities that we have been implementing include the training of health volunteers. We call them health scouts, health and environment scouts. We've worked also through school clubs to raise awareness and interest children, the next generation, into understanding the linkages between their health and the health of their environment. We've worked with local NGOs, government partners, who are across the board are the ones who help us implement the projects, especially for the health side of the components. As WWF is not a health organization, we always try to partner with local NGOs or government health partners, as well as if we can, with international NGOs as well in the field of health, to help us implement those approaches. We have trained women to become focal points to facilitate work through mothers groups for addressing issues of nutrition and recognizing malnutrition, and for them to understand how to prepare appropriate complementary foods and with what they have in their local environment, and on family planning, reproductive health issues as well. And all this work has always been supported by the health staff in the government structures around the project area. We've trained the Baka traditional birth attendants, male and female youth, on family planning, reproductive health issues to educate peers, as we found that a peer-to-peer approach of education was a lot more efficient, reaching out to these communities, and also using the skills and the knowledge of the traditional birth attendants who are highly respected in those communities. We collaborate with local partners, civil society organizations, community-based organizations, as I said, the government partners, but in various sectors, so that we have an integrated approach to working with all these different sectors, and so that the government, the different actors in these sectors understand the linkages between health, agriculture, environment, ecosystems, and education, and all of that coming together. It's a very efficient way to conduct our interventions when everybody is on board and understands how the work of each affects their own work. We have used the health and environment scouts and other volunteers also to conduct mass campaigns on different PHE messaging and group demonstrations and discussions on these messages and best practices. And we have used also those health scouts to help give technical assistance to households to build household latrines and disseminate like wash messages and demonstrating how to have a good hygiene and sanitation approach. We have also provided, and we still provide, technical support to communities in the various PHE cross sectors, including women's groups, and that includes promotion of alternative livelihoods, sustainable livelihoods, helping them with savings groups, like getting started with their savings groups, and but always keeping in mind that whatever livelihoods they want to pursue, that it's something they want to do, but it's also something that is that addresses that is climate smart, that is sustainable, so that they understand how to take care of their environment as well. So the PHE outcomes so far that we have seen in this area have culminated into those activities in nutrition, food security, and sustainable agriculture, family planning, and reproductive health have helped us identify cross-cutting solutions to ensure biodiversity conservation, sustainable development in the communities living around Lobaike National Park, while always keeping in mind the empowering women, keeping gender inequality in check, and involving the most vulnerable groups, such as the Baka indigenous peoples. So that is the end of my presentation, and I will be happy to answer any questions that you may have.
Thank you so much. That was so interesting. Okay, we have quite a few questions that came in through the chat, and then there's some that were submitted, through through the sign up form. So we can do the chat questions first and then move to the previously submitted ones if that sounds good. So let me
That sounds good. Should I stop sharing my screen or?
Sure, it's up to you.
Okay.
It's entirely up to you. So let's see. Some of these are a little bit long. Here, we'll start with this one, the most recent one. It feels like a good one to kick off with. So, for the BACA people that you spoke about specifically, does having children provide a social safety net for them? And how can this potential barrier to reducing teenage pregnancy be overcome?
Yes, of course, in those areas, the high rates of infant and child mortality, makes so that people want to have many children to help to help keep a few around so that they can actually support family in as you say, as a social safety net. However, the way that we promote voluntary family planning, reproductive health, we always try to promote maternal and child health. And we do it in a way that we talk about, healthy birth spacing and birth planning, so that it's clear that people understand that they can have the number of children they want, but to make sure that they keep them alive, that the mother has a healthy pregnancy, and that they put all the positive things on their side that they have to take into account, healthy birth spacing. And there's high rates of HIV/AIDS in that area, of STIs as well, sexually transmitted infections and so on, that also is a very big part of our promotion for reproductive health and so on. But the way that we approach the question also is quite clever. I find, the health staff in the area have found a way to make people realize by themselves their own issues with having too many close pregnancies and having many children that they cannot provide for. They go through exercises where they make people make a list of the sick family members in their communities and those who have died recently or within the past 12 months. And they list these people, and they list the causes that they know why these people have passed away, or they've been sick, and then it creates a map of a community, and people start realizing that by doing that, they start realizing, this family, had such and such a death in the past 12 months because the mother had pregnancies too close together, and they didn't have enough food to feed the mother while she was pregnant, and the kids were hungry, and one died of malnutrition. And so there's a whole sequence of thinking that goes through, that people go through, and they realize by themselves that it's probably wise to plan for pregnancies, and to especially also that so many young girls, 12-year-olds, 13-year-olds get pregnant, and their maternal mortality rates are so high because of the teenage pregnancies. So putting all of that together really helps in making people realize that they are, that there's changes that need to happen in their behavior relating to family planning.
Right, they see the
Yeah.
patterns so that
They do see the
they can
pattern, and
understand it.
it's not someone coming to tell them what that pattern is. It's the thinking, and the whole process of finding that out by themselves is quite powerful, actually.
Yeah, that's really interesting.
Mhm.
Okay, here's another one. All right, so this is a little bit of what you, I guess, what your opinion is, informed by your work is, do you feel that there's a fundamental conflict between human rights and animal rights, since advocating for wildlife necessarily means you're constraining human activities?
Well, so it depends how you, so it's like a chicken and egg thing. If you, these people depends so much on their environment, meaning a forest that is being illegally logged and poached means that the wildlife inside that forest will not be around to help that forest thrive. If you think of elephants, how by their very but the nature of how much they travel, how much they transport seeds that they eat, and disseminate those seeds across the forest to replenish the forest, to keep the forest healthy. Each of these animals have a role to play in the ecosystem. If you take one out, and a major one like elephants or gorillas, who really help in the health of the ecosystems, you're affecting down the line, you're affecting people's health as well, because they may have to go further into the forest to find food and water, and they may also not be able to find those things. So it puts people's health and well-being at risk as much as it puts the environment at risk. So if you find the ultimate thing is to have a symbiosis. So you have healthy people who take care of their environment, so that way you will be able to they will be able to live there and to live from the natural resources for very long term. So it's not just and the work that we do, we always look into if a people is used to going into one forest and that forest becomes protected, how can we make sure that there are alternatives? And WWF does not itself restrict people from going into a forest. It's, nationally there may be laws, and the government decides to declare an area a protected area. That way we work with these people to develop management plans so that they have areas sometimes within the protected area and outside of the protected area where they can hunt and they can cultivate, and to make sure that they have the resources necessary for livelihoods and to be healthy. So our job is to make sure that people really thrive in their environment, and that means finding all the ways possible, the solutions that are appropriate for them and that are appropriate to keep the environment healthy, so that they can benefit from keeping that environment healthy. So
right, so it's less about constraining activities, as this question sort of posed, and more about finding that balance so that the environment is there for the long term, because the people who live there also depend on it. So it's
absolutely.
not, I think it's a different mindset of, it's not so much restrictions as creating sustainability. Does that sound accurate? Okay.
Yes, absolutely.
Okay, let's see. Thank you. That was an excellent answer. All right, this is more related to our work, so you can think I know the answer to this one, but I'll let you speak about it. Is one of the goals of the World Wildlife Fund PHE initiative, and I guess this is the kind of your PHE initiatives in general, to bring population levels down. Why or why not?
Um, so there's years ago, there was, I mean, there's still that, there's still this discourse in some circles where, you know, like, why do conservation organizations work on population issues? For WWF, we have an approach that is holistic. We like to think that we're never in an area where we work. There's needs, there's basic needs that are not being met, health needs that are not being met, and that means family planning, reproductive health services are not being provided just as much as the basic health needs that are not being addressed. So when we work in an area, we address the most pressing issues that we see and that people express being a high need for them. So it may be, in some places, it may be addressing HIV/AIDS issues, WASH issues, malnutrition, you know, and so we approach it as, within our conservation work, we also address these pressing issues that people have, and very often that includes also, you know, strengthening health services, and access to health services includes access to family planning and reproductive health. And it's always put in the framework of helping communities, families and households be healthier and be able to live in more harmoniously with their environment, and that means addressing issues of reproductive health and family planning. Yeah, so we address it more on a health, maternal and child health, and household and community health, rather than thinking of population pressure on the environment.
That makes sense. Okay, I'm not sure if you'll know the answer to this, but globally, are PHE programs generally better supported in women-run countries? So are women-led countries more supporting of PHE? If you don't know the answer, that's fine.
Well, I can't say that I haven't been involved in places where countries are led by women. However, I can say that when there are many women in different ministries, including ministries of environment and conservation and fauna and forests and so on, it's much easier to make the point of PHE being something important to include in conservation programming. And it also helps in placing the right people in those ministries. You know, if you talk about the importance of gender equality and social inclusion and health of communities and health of, you know, women's health and women's rights and so on. When you have ministries that are open to this, it's easier to also advocate and win the fights in having focal points, working on women's issues and on gender in those more male-oriented ministries.
Got it. That makes complete sense. Okay, we're running a little short on time, so we'll do maybe one or two more questions. And then just so everyone knows, any questions that we got in the Q&A and also beforehand, we'll send to Nathalie separately so that she can answer them, and we'll email those answers around if it doesn't get covered, you know, here on the talk. So let's see. Do you have anything you could sort of say to speak about the impact of, you know, climate change, especially now as we see it getting worse on vulnerable communities, and how your programs help build resilience in those communities, you know, to climate change.
Mm-hmm. Yes. So I think I touched a little bit on that, but I can go in a bit deeper. So whenever we work with communities, when we talk about sustainable development, sustainable agriculture, we also mean climate smart, especially in some countries where it's way more, you know, that climate change affects people more rapidly. For example, in the Himalayas, in Nepal, in India, in Bhutan, in certain areas of Africa as well. It is clear that we cannot just go about promoting sustainable agriculture without thinking of what's coming in terms of climate and how people will be affected down the line by droughts or extra, you know, flooding and so on. So the approach is to always keep that in mind, and we have regular assessments that we conduct in all our programs to ensure that we stay one step ahead in terms of assessing, you know, vulnerability, assessing the risks and the changes, and adapting rapidly sometimes to those changes, and making sure that we use you know, nature-based solutions to making people more climate resilient. Yeah.
Makes sense.
Yes.
Thank you for answering that. Okay, so with the 1 minute left, so I think we'll wrap it up. I'm just typing in the chat that if there's any further questions, like I said, we saw the Q&A questions, and we also have the email questions, but if anything else came up, you know, I saw someone had their hand up, and you know, we ran out of time to address that. If you could just send those to engage@popconnect.org, we'll get answers out to everyone, you know, as soon as we can, you know, being respectful of everyone's time. But thank you so much for joining us, everyone. And thank you so much, Nathalie, for doing this presentation. It was very interesting, and it was really great to see all of the projects that, you know, you're involved in, that World Wildlife Fund is doing. And I think something that, you know, a lot of people don't necessarily realize is such a big component to conservation work, you know, and how much, you know, how important it is to consider, you know, these aspects of that work. So, and it ties in, you know, with what we advocate for and what we do. So we very much appreciate your time.
My pleasure, and thank you for the questions, and for the opportunity to discuss what we do at WWF.
Absolutely. So, right. Thank you, everyone, and hope you'll join us again soon.
Have a nice rest of your day.
Bye.
Bye.
Bye.